I'm Dr. Ashoojit Kaur Anand. I'm a palliative care specialist and I run this program called Aveksha, which is a home-based primary care. And my clinical-based practice is at PCMH Restore Health at Sheshadipuram. I'm passionate about improving quality of life of people who are suffering because of an illness. It could be a short-time illness, it could be a long-term illness too. Many a times people mistake palliative care only to be the care for the dying. But palliative care actually is a care, it's a umbrella which covers symptoms of, that is when a person could be suffering from pain or could be having loose motion or could be having vomiting, nausea. So all these symptoms, when they are covered under an umbrella, it is the palliative care, which starts from the time of diagnosis of an illness and continues throughout as long as the treatment is given, and even when a treatment fails and a patient is dying, or continues even after the death of the patient with something called the bereavement support for the family. So that is what is palliative care, and it is not just the end of life care. So palliative care is not just offered to people who have cancer, which is normally thought about, but it can be offered to people who are suffering from illness which does not have a cure or does not have a treatment which cures them. So it could be heart failure condition, it could be kidney failure, it could be anything which has a long-term illness which continues and does not necessarily be cured. That is what is palliative care.